It'll accomplish what all the companies are trying to do, which is drive down my healthcare costs. But I think what they need to understand is the real value of the model, which I don't think they get, right? And maybe that's too deep for them, and we don't want to go there. I don't know, right? I mean, everyone's doing all kinds of wellness programs and incentives. If my blood sugar's low and my weight's, my BMI's low, and if I meet these things, then my premiums are reduced. I mean, all the companies are trying to figure out ways to incentivize wellness and healthier living, so I pay less money, right, on the backside. And this is, I think, a great opportunity to do that, because what it does is it creates that relational medical care versus transactional, so that people will go take care of things like my blood pressure is high, and opposed to just taking medicine and hoping it works, right? That is like the number one thing that all the companies are trying to figure out, right? Is how do we create healthier lifestyles in our employees so that we can reduce our healthcare costs? Because that's my biggest expense, right? The insurance and medicals, that's what I pay the most money at, for my employees. If I talk about, if I take my employee, when I sell my employees products, right, and I price it out, so I've got the cost of labor, which is my largest expense, but my next largest expense is my fringe, right, my benefits. That's almost 50%, right? So I have to mark up my salaries almost 50% to cover my fringe, right? And then I mark it up, 10% to cover my overhead and another 10% to cover my G&A, right? So, my fringe is over half of my total markup, right? And so other than direct labor itself, my most expensive thing is my fringe benefits. So anything I can do to drive those costs down give me a competitive advantage. And as the more employees I think I can get in that clinic, year over year, I'm going to see my costs go down. And so that markup starts to go down, right? And I become more competitive in the marketplace. Or conversely, I get more margin, right? I hold my price the same because I'm competitive still, but now I can make more profit on it. And now I have more money to reinvest in, R&D and, capital and things like that. I'm paying a fixed fee to the clinic, right? So I pay them a set amount of money. The more visits, right, I'm actually getting a better deal. If I can get my employee to go 100 times, right, and then that money I spent, is now supported 100 visits versus 10 or whatever, right? So it incentivizes me to get my employees to go more, which I think is the point. I think that's the intent of the model, and to make it affordable enough for the employees to then pay their piece of it, right? And then, the doctors can, and the other thing, whether it's really part of the model or it's part of the vision of Roger and his staff, is they're pretty much a one-stop shop.